Welcome to Nurses with Voices, the podcast where we amplify the voices of nurses everywhere. I'm your host, Dr. Lendra James, DNP and I am thrilled to go on this podcast journey with you. As a nurse with over 20 something years of experience, I've witnessed dedication, resilience, and passion that defines our profession. Through this podcast, we aim to educate, empower, and inspire nurses at every stage of their careers. Whether you're a novice nurse navigating the challenges of bedside care, an experienced clinician looking to advance in your field, or dreaming of becoming a nurse entrepreneur, Nurses with Voices is here for you. Join me as we delve into topics such as advancing in nursing, mastering leadership skills, and fostering a supportive community within our profession. Together, we'll explore the triumphs, struggles, and countless opportunities that come with being a nurse. So tune in, subscribe, and let your voice be heard, because here at Nurses with Voices, every nurse has a story worth sharing, and every nurse voice deserves to be amplified. Hello, and welcome back to another episode of Nurses with Voices. I am your host, Dr. Lendra James, DNP and today I want to continue our discussion on the latest trends and events shaping the healthcare industry. So last week we started talking about this. We were talking about navigating healthcare trends in 2024 and the implications that it has on nursing. So in today's episode, I want to continue that discussion, and I want to continue to really analyze recent events and trends and those implications. Simply put, I want to explore how these trends impact nursing and nursing practice, right? And discuss the strategies for nurses and healthcare professionals to navigate the changing landscape of healthcare. Just to remind you, in last week's episode, we mentioned strikes, right? And this is one of the trends that I want to discuss today. We mentioned strikes, and I said that I would dedicate an episode to strike nursing. Well, since then, strike notice have been received at a certain hospital. So I wanted to talk a little bit about that and the implications that strikes have on nursing and on organizations. Now, strike nursing is a phenomenon that is becoming more and more prevalent in the healthcare industry, and it has profound implications on both staffing and patient care. Now, let me preface this by saying that in nursing has been around, right? I myself have taken part in strike nursing. I mean, for over a decade. I mean, I think I was doing strikes since around 2010, and the pandemic really highlighted travel nursing, which in some ways highlighted strike nursing. Right. Now, this is my opinion, right? This is based off of my experience and my opinion. But strikes are something that has been around for so long. So just imagine being able to work one day or 3 days and, make what you would make in a month. Right. So this is why strikes have become, and the more nurses get wind of this, or healthcare professionals, because strikes, when someone goes on strike, and depending on the institution, that union may cover, nurses and respiratory therapists, right? Or that union may cover nurses and nursing assistants. I mean, a lot of times the ancillary personnel have their own union. However, that bargaining unit can cover many different disciplines, which is why there could be such an impact on organizations. However, just to have the impact of losing your nurses alone who are at the front line, that's a huge impact. Think about the patient care that isn't happening or isn't occurring because, or at least it occurs because you have strike nurses who comes in, right? But you don't have the nurses who are used to this culture. You don't have the nurses who are used to the physicians. They're used to the practitioners and the providers, and they know the policies, right? A lot of times they know the policies in and out. So they may have been at this organization 5 years or 10 years. So there are things that they know that the strike nurses who are coming in for a day, 5 days, 10 days, they may not be aware of. So strikes really it puts everyone at it impacts everyone. Like, there is such an impact on not only the nursing team, but also organizations. As nurses, we're usually at the forefront, right, of patient interactions. And when there's a strike, it's inevitable that, it's going to be a disruption in the continuity of care, and it places additional strain on the remaining staff. So you have your nurse managers, you have your directors, you have your physicians, everyone's on high alert. Right. So the rise in strike nursing, it really underscores the underlying tension between healthcare institutions and nursing staff. And it's often stemming from issues such as inadequate staffing, um, compensation rates, working conditions, ratios. So these are the things that, when you ask bargaining units why certain organizations are going on strikes, this is what they'll tell you. So while strikes serve as a mechanism for nurses to voice their grievances and advocate for change, they also introduce challenges for the organization. It introduced challenges for the organization to maintain adequate staffing levels and really deliver optimal patient care. So, on an ordinary hospital day without a strike, hospitals are advocating for quality improvement and patient experience, right? So, and strike nursing contributes to increased workload and burnout among nurses in several ways. So, first, you have your nurses who choose to participate in the strikes, right? So they may feel torn between their commitment to advocacy and then their dedication to patient care. Secondly, you have your remaining staff members who are often required to work longer hours, right? So this is what I mean when I was saying how everyone is impacted. Your nurse directors, your nurse managers, your physicians. Let's think about your ancillary staff as well. You have your technicians, those who are not a part of that particular bargaining unit. So now the strain is falling on them to really pick up the slack, where the nurses who have gone on strike, now there's an extra strain that is on the remaining staff. So that's what I mean about that strain being on the remaining staff in the hospital. So now they're working longer hours, right? They have additional responsibilities to compensate for the absence of their striking colleagues, and the heightened workload can really lead to feelings of exhaustion, frustration, and, even burnout among hospital staff, including nurse leaders, impacting their overall well being and their job satisfaction. However, these are the things that we have to consider. These are the things that organizations really have to consider when, when they're bargaining, right? And when they're asking nurses to do more with less, and when you introduce these bargaining units into the hospitals, they're really going to really advocate. Now, organizations, they don't really like to have unionized, unions within their facilities, and for a number of reasons. And I can say this because I've worked as a nurse leader, right? And there's always you know, there's I want to call it a myth, but there's a level of we really don't want unions, but we tolerate the unions. And the reason that we don't want the unions, because the union is advocating for things that is going to may possibly cost the hospital more, right? And when that happens, or when that occurs, or the unions also empower nurses to have a certain voice that they probably wouldn't have. So I see both sides, because I've seen nurses who have been a nurse 5 months and they're out there striking. And you ask them, like, if you ask them why they're striking, and they don't know why they're on strike. They just know, or they just think that there is a bargaining unit that is advocating for them, and they want to be outside on the picket line with the others, and not realizing or asking the right questions. How am I going to be impacted by this strike? Right? What happens where there was a hospital that was on strike in New Jersey for about 5 months. And I understand some of those nurses took travel positions to, and it's not, I mean, I don't mean to, it's not, I don't mean to laugh, because I don't want to undermine their reasoning for striking, but you have to understand your reason for striking, because I'm going to be out of work for 5 months. Why am I out of work for 5 months? Right? Because that's time when I don't get paid. Now, I do understand, for some strange reason in New Jersey, if the hospital organization go on strike, they can actually file for unemployment. So that might be one of the limited states that can actually do that. But most states, when they go on strike, you don't get paid. So you want to know and you want to be involved and you want to understand, why are we on strike? Are we striking for, because, some of these bargaining units, they can actually be striking for their own selfish reasons. And again, this is my opinion, and I may catch a lot of flack for saying that. But again, I'm saying this speaking as a nurse leader who have experienced both sides, right? So I've worked as a unionized nurse and I've worked as a nurse leader, right? So I've seen both sides. And sometimes these presidents of these unions, they have an agenda that can impact nursing in a way that's if they knew exactly their reasoning behind going on strike or behind not settling on a contract that is completely fair and equitable, they would really really second guess having a union in their organization. And I can also say, I can remember working for an organization where the nurses voted the union in, thinking that they wanted this union. And apparently there's a stipulation and there's a clause where if you vote a union in, you have a year to vote the union out. And when that year came up, they took another vote and they actually voted the union out because they didn't see where the union was going to be beneficial for them. And actually, it was at an organization where the hospital, the administrative staff, they were really, really, really pro nursing. And this was at that time, right? However, I understand that times change and things change, but just because you have a unionized and you're in a unionized environment doesn't mean that they're fighting for you the way they should be. And that's why, and that's the only thing I bring it up to say. Now there's some organizations that they do need a union, and I would be the first one to say, like, yeah, they need a union. They need a union in here. So there are organizations, and again, I can say these things because I've worked across the country and I've worked in different environments. So when you've worked in environments that were, really advocated for nursing, it. When you work for environments that don't advocate for nursing, it as well. However, the fact that there are a lot of strikes that are popping up around the country, it speaks volumes. It speaks to, the level of respect. It speaks to, there's a void that nurses feel that they're not getting. And that's why, organizations really have to open up their ears and listen to their nursing staff, really hear what they're saying, what they're trying to accomplish. And it's important and it's huge because it's going to make it makes a difference. So to really address these challenges, nurses can advocate for their rights and navigate employment options during strikes through various strategies. They can participate in the collective bargaining negotiations. Some nurses don't even realize that. Some nurses don't even realize that you can be a part of the bargaining negotiations. But sometimes we want to come in and we want to swipe in and swipe out, but we're not really taking part of decisions that really impact us and impact our practice. You know, Additionally, nurses want to explore alternative employment opportunities, right? Like, what are the temporary staffing agencies or per diem positions to maintain your financial stability during strikes? Like I mentioned, the nurses who went on strike in New Jersey for 5 months, they were, some of them, I understand, took travel positions for about 13 weeks or so, until they knew, that the hospital was, that they were coming back. Listen, um, and I'm not mad at that. They needed some way to make ends meet, right? The other thing is, my go-to is starting your own business. But before, if you're not ready for that, but before you get to that, you have to have some type of alternative, for nursing, for what you're going to do for financial stability when your bargaining unit decides to go out on strike. You can seek support from nursing professional organizations, right? And unions, which can provide resources and guidance and maybe even legal assistance throughout the strike process. You have to stay in the know, and you want to know what's going on, because ultimately, strike nursing, it really highlights the complex interplay between labor relations, patient care, and nursing workforce, right? So by understanding the implications of nursing and advocating for their rights, nurses can contribute to positive change within the organizations, while ensuring delivery of high quality care to patients. Organizations really do not want to organizations don't want to go on strike, right? Because the cost does not outweigh the benefits. And it gives the organization a bad reputation. So no matter how strong they think they come across as, we're not settling, or yes, they have the right to strike, and, we're still standing strong, it's nurses don't really want to work at an organization where they don't feel that they're viewed by that organization or as value, right? And, because nurses are at the forefront of the healthcare, and organizations, they don't want that reputation. So as I really segue into the next trend, I want to talk about hospital financial challenges, because when you consider a strike, strikes pose a huge financial challenge to organizations. So when you think about the nurses who went on strike at this organization that was on strike for 5 months, those nurses probably made what you will keep them out of work for at least maybe 2 years. Now, the nurses who went on strike before Aya Healthcare came in, the nurses who were with the original strike company, if the ones who were there from the beginning to the end, they, they'll probably be set for at least 2 years, and they could probably take that money and invest in real estate. They can probably take that money and invest into their own business, because you want to have a plan, right? So it's not about just making that money. It's about having a plan. What am I going to do with this money that I make? Okay, great. I just made $6,500 in 3 days. Okay, great. But what are you going to do with it? So it's about having a plan, not just making that money. It's about having a plan for that money. And I think that's where a lot of times we miss the boat. However, just going back, before, I don't want to, go into I don't want to spiral here, because I want to maintain what we're talking about. However, it is a financial challenge for organizations to have a strike. So, you have a hospital have challenges to begin with, right? So you have rising expenses, you have patient acuity. These are all significant factors influencing nursing staffing and resources within healthcare organizations. So, as hospitals face financial constraints, they implement cost cutting measures that directly impact nurse staffing levels, leading to increased workloads, reduced resources for nurses. For example, hospitals may freeze hiring, right? They may reduce overtime, or they may implement layoffs to control expenses, resulting in understaffing and then heightening stress among nurses, right? Because they're laying off the areas that impact nursing, right? So these implications of these financial challenges for nursing staffing and resources are twofold. Firstly, you have nurses experience burnout, right, and decreased job satisfaction as they struggle to meet the demands of patient care amidst staffing shortages and resource constraints. Secondly, you have inadequate staffing and resources that can really compromise patient safety and quality of care. So, as nurses are stretched thin and unable to provide optimal care to patients, they become burnt out. And, it's a domino effect, right? So, to address these challenges, nurses can really explore innovative approaches to cost containment and revenue generation, such as leveraging their expertise to establish independent healthcare consulting businesses. You can offer specialized services really tailored to emerging healthcare needs. And so here are some businesses that nurses can start. Nurses can do healthcare coaching business, right? You could be a health coach. You can offer personalized coaching services, focusing on wellness, nutrition, lifestyle modifications to really help clients achieve their health goals. You could do a home healthcare service, right? You could provide in-home healthcare services such as wound care, medication management, assistance with activities of daily living. You could do telemedicine practice. Last week, we talked about nurse practitioners starting their own telemedicine businesses. That way, you can offer virtual healthcare consultations and follow up appointments to provide convenient and accessible healthcare services. You could do medical writing and consulting. You could provide medical writing services such as content creation for healthcare websites, medical journals, pharmaceutical companies. Additionally, you can offer consulting services to healthcare organizations on regulatory compliance, quality improvement, patient safety. You can have a mobile health clinic. You can operate a mobile health clinic to provide healthcare services like vaccinations, health screenings, preventative care to underserved communities and corporate settings. You could do holistic wellness, right? So you can establish a holistic health and wellness center offering services such as acupuncture, massage therapy, excuse me, nutritional counseling. You could do nursing education. I mean, I can go on, right? You could do CPR services, So these are just a few examples of the types of businesses nurses can start based on their expertise and skills, and passion for healthcare. With creativity, determination, and entrepreneurial spirit, nurses can really make a meaningful impact in the healthcare industry while pursuing their own entrepreneurial goals, right? And this is a trend as well, right? Nurses are becoming more and more empowered to get out of the rat race and remove themselves from the burden and overwhelm of working at organizations that just don't value their expertise, right? And so this brings me to the next trend, and is talking about governmental healthcare payers. So this kind of ties into the financial responsibilities, right? So the dominance of the government funded healthcare programs such as Medicare and Medicaid have significant implications for hospital revenue and reimbursement rates, and changes to healthcare finance models, including shifts toward value based care and bundle payment arrangement, directly impact hospital finances and reimbursement rates for services provided by nurses. So, for nurses, navigating changes to healthcare finance models present both challenges and opportunities. So, on one hand, changes in reimbursement rates models may affect one, nurse staffing levels, two, resource allocation, and three, the delivery of patient care. Nurses face pressure to do more with less as hospitals seek to maximize their revenue and minimize costs to response to changes in reimbursement structures. So nurses are asked to do more with less. On the other hand, nurses have a vital role to play in advocating for fair reimbursement rates and equitable access to care for all patients, right? By actively participating in policy discussion, engaging in healthcare policy making, and advocating for evidence based reimbursement policies, nurses can ensure that the needs of the patients and frontline healthcare providers are prioritized in healthcare financing decisions. So, both of these trends that I discussed, along with strike nursing, highlight the interconnected challenges and opportunities facing nursing in the current healthcare landscape. So, thank you guys for joining me today. I hope you enjoyed this, these trends that we've been discussing and how they're really impact nursing. And for nurses, I really want you to really consider and start having some takeaways, and let me know your thoughts. Let me know what your thoughts are on these trends that we've been discussing, because they're really, really, really important. And, we're at the forefront. Something you want to continue to remember, that without us, a lot of times we're at the forefront, and without us, these organizations, they really can't really prosper without our expertise. And if you're in a situation where you're feeling undervalued, just know that there are other opportunities for you. Strike nursing is one of them, but strike nursing is not all, it's not there all the time. So what is your strategy? What is your plan? Right? What is your plan to be able to do more and to create generational wealth for your family, to create peace of mind, to have a breakthrough from your burnout? What's your plan? All right, guys, until next time, stay educated, stay inspired, and stay empowered. And I'll see you in the next episode of Nurses with Voices.